see Martha E. Rogers' theory, that is the science of unitary human beings. This is a grand theory, and you may find this theory is most abstract and difficult to understand. Let's move through this theory. Regarding the theorist Martha E. Rogers, she was born in Texas, USA on May 12, 1914. She shares the same birthday of Florence Nightingale. She received her BS and MA in Public Health Nursing. Later on, she did her MPH and Doctor of Science from Johns Hopkins University. She has written a book, An Introduction to the Theoretical Basis of Nursing. She died in March 13, 1994. She believed that a person or a patient can never be separated from their environment when addressing health and treatment. She held various posts in the leadership and staff positions in community health nursing. She even established the first visiting nurse service in Arizona. And later on, she worked as visiting lecturer and a research associate. Dr. Rogers was professor and head of the Division of Nurse Education at New York University, and she became professor emeritus at New York University. Dr. Rogers was active in numerous professional organizations, received many awards and honors, and published extensively in numerous nursing journals. She wrote several books and contributed chapters to many others. According to Rogers, the definition of nursing is a humanistic and humanitarian science which is dedicated for maintaining and promoting health, preventing the illness, and caring for and rehabilitating the sick and disabled. So this is an art of humanitarian and humanistic science. Rogers believed that the knowledge of the past is necessary for understanding the present and for evolving the theories and principles that guide nursing practice. Nurses need to know about the past history of the patient. Knowledge coupled with a high degree of humanism. Not only knowledge, the nurse should have humanism also, and value of life. It made advancement of nursing through scientific means and theoretical development. This is the most important point in Rogers' theory. Knowledge should be coupled with humanism and value of life, which we all nurses need to incorporate. Her theory is grounded in 5 basic assumptions, 4 concepts, and the principles of homeodynamics, which are 3 in number. Roger postulated her theory of science of unitary human beings. Let's see one by one. First are the 5 basic assumptions of Roger's work. The first assumption of Roger is man is a unified whole possessing integrity and manifesting characteristics that are more than and different from some of the parts. Same like other theorists like Henderson and all, how they told human beings are a unified whole. We cannot separate its parts and tell that this is a human being. That some of the parts is more. And this human being has got an integrity and they show certain characteristics. The second assumption of Roger is man and environment, they are continuously exchanging matter and energy with one another. The third assumption of Roger is the life process of man evolves irreversibly. We cannot go back, and in particular one direction, unidirectionally, along the space and time continuum. The fourth assumption is pattern and organization identify the individuals and reflect their innovative wholeness. Every human being has got a particular pattern and organization of life. The last assumption is man is characterized by the capacity for abstraction and imagery, language and thought, sensation and emotion. Out of all the organisms or the living things, man is the only living thing that can imagine, they can think, they can have feelings, emotions. So these are the 5 assumptions of Martha Rogers. Next comes the 4 concepts or building blocks in Rogers' nursing theory. The 4 concepts or the 4 building blocks in Rogers' nursing theory consist of something which is common to both the human beings and environment. They are, the first one, the energy field, the fundamental unit of both the living and non-living. According to Rogers told both the living beings and the non-living things and the environment, there is an energy field. It has no boundaries, it is dynamic, is in continuous motion, and there is a variation in the intensity, density and extent of this energy field. So the first thing which is common to the living things and the environment is the energy field. The second concept is the openness. The human beings and their environment are open system. That means there is an exchange of this energy between these human beings and this environment. There is no boundaries that stop the energy flow between the human and environmental field. The third concept is regarding the pattern. That is the distinguishing characteristic of an energy field. It is seen as a single wave. An irreducible, non-materialistic aspect of life is this pattern. It is a little abstract, but this is the pattern, the single wave that gives identity to the energy field. The fourth concept is pan-dimensionality. This energy field, even though it is a single wave, it is a non-linear domain without any limit to the space and time. When we are considering these 4 concepts, we can tell or we can define human beings and environment. Human beings are defined as irreducible, indivisible, pan-dimensional energy fields identified by pattern and having characteristics that are different from those of the parts and cannot be predicted from the knowledge of the parts. So with regard to the energy fields, its openness, its pattern and pan-dimensionality, human beings is defined by Rogers. And also environment is defined by Rogers as irreducible, indivisible, pan-dimensional energy field identified by pattern and manifesting characteristic different from, yet it is integral to the person. As a living system and energy field, the individual is taking energy and information from the environment and releasing energy and information to the environment. Because of this exchange, the individual is an open system. So this is what the concept of Rogers theory is. And third one is the principle of homeodynamics. Homeodynamic principle postulate a way of how to view the human beings. There are three principles of homeodynamics which is given by Rogers. They are resonance, helicity, and integrality. Let's see one by one. Resonance, first one is integrality. Because of the inseparability of the human beings and their environment, sequential changes in the life process are continuous revisions occurring from the interactions between human beings and environment. Integrality means when the humans and environment interact at that time, there some changes happens in the life process and continuous revisions will happen. This is what integrality means. Second one, resonancy. It speaks to the nature of the change occurring between the human and the environmental field. So continuous change can be observed. For example, there will be sleep-wake rhythms are there, hormonal level changes are there, fluctuating emotions are there. So these occur between human and environmental field when they interact. Third one is helicity. Human environmental field is a dynamic open system in which change is continuous due to the constant interchange or exchange of energy between human and environment. Because of the constant interchange, an open system is never the same at any two moments. It is continually new or different. So these are the three principles of homeodynamics. When we are dealing with the nursing process approach of Rogers, we will be seeing the human being based on these three principles. The propositions in Rogers' theory, what are the connections? The nurse is an environmental component for the individual receiving service. Nurse is a part of the environment and exchange of energy happens between the nurse and the patient. The primary focus of nursing is to promote the health of the patient. And the third proposition is the purpose of nurse is to promote wellness for all persons wherever they are. The metaparadigm of Martha Rogers' nursing theory first is about unitary human beings. Unified human with individuality. That is what a human being is. Each person is different. The life process of human evolve irreversibly and unpredictably. We cannot tell what will happen in human's life. Humans are capable of abstraction, imagery, language, thought, and emotion. Unitary human beings and their environment are the focus of nursing science and give nursing its unique perspective. So this is what a human is. Second one, environmental energy field or environment. It is an open, irreducible, invisible, pan-dimensional energy field which is interacting with the human being. The third meta-paradigm, the health. It is the expression of human beings' life process. The characteristics the human beings show, the behavior which is coming out from the mutual simultaneous interaction of the human and environmental field is what is health. The health and illness, they are part of the same continuum. Multiple events occurring during the life process show how a person is achieving his or her maximum health potential. So this is what health is according to Rogers. The last, nursing as a meta-paradigm, it is defined as an art and science that is humanistic and humanitarian. It is the study of unitary, irreducible, indivisible human and environmental fields. Rogers claims that nursing exists to serve the people and the safe practice of nursing depends on the nature and amount of scientific nursing knowledge nurse bring to her practice. And we already told it is not only knowledge, there should be a humanity and value of life should be an important aspect of nursing. Nursing aims to assist people in achieving their maximum health potential. The arenas of nursing service extend into all areas where there are people. It can be at home, it can be at school, at work, at play, in hospitals, nursing homes and clinics on this planet, and now moving to outer space. So everywhere nursing can be provided. This is about the four meta paradigms. Now, how to discuss this theory with the nursing process? We know that the Rogers theory of unitary human beings, we will be dealing according to the principles of homeodynamics, that is the principle of integrality we will discuss, principle of resonancy and principle of helicity. And we can tell it as a division into two phases: assessment phase. The second phase is known as the voluntary mutual patterning, which includes the nursing diagnosis and planning and implementation, and last is the evaluation. So the first component of the nursing process is the nursing assessment. So in this, whatever aspect we need to collect data from the environment or something which is related to individual, we will be collecting as the first step. So you know that when we are seeing the principle of integrality, we will be looking at how the individual and the environment are interacting, and is there some adjustments or maladjustments with the environment and human being. This is what we will be seeing in the first principle of integrality. For this, we need to ask questions to the patient. How does the patient see his or her environment? What differences are there between the hospital environment and the home environment of the patient? How is the patient reacting to the change in environment? How health problems affect the environment? So these are some of the questions you will be asking for the assessment to collect data regarding the individual and the environment. Next, regarding the principle of resonancy, we need to see what are the variations that occur during the life process of humans. Because of the interaction between the human being and the environment, what changes had occurred? So what are the past history that we will collect at this point? What are the deviations from the normal values that we will collect for the patient? What is the reason for the present hospitalization we will collect? How it will affect the patient's life we will see. Then the third assessment part is the principle of helicity. Third homeodynamic principle, if we are seeing, that is the principle of helicity. We have to look at the rhythmic life patterns of the individual and the environment. We have to look at the life goals of the person. What are the normal behaviors and routines of the patient? What activities patient can perform? What is the developmental level of the patient? What are the goals to be achieved? These are the questions we will be asking related to the principle of helicity. All these questions comes under the nursing assessment part for the patient. We will be understanding everything about the patient and the environment at this. The second one is the nursing diagnosis component. So in the integrality component, you need to reflect what is the integration of the energy field between the patient and the environment. That is there interaction between the patient and hospital according to, because of the interaction, whether any problems have developed, for example whether there is a risk for infection, like that you need to see. Then second one is related to resonancy. It reflects variation in the life process. Here you need to ask the question, what is the interference the hospitalization will make in patient's life? Maybe after the surgery there can be some deformity, so that risk or that deformity can be considered as another nursing diagnosis. The third one, helicity. It reflects the rhythmic pattern of individual and environmental fields. What are the patterns that are being exhibited by the patient, whether there is a fluid volume deficit, so whether there is a problem with their intake and output. All these things you need to see and develop a nursing diagnosis. Third one is the nursing plan and implementation. So in the integrality, first, how the environment and individual is intervening. So there you need to ask, how can the hospital environment be modified to reduce the differences identified, and how patient be helped to understand the differences that cannot be eliminated, whether any support systems can be provided. All these things we can think of. Then next is regarding the resonancy. Support or modify the variation in life process, how normal development can be promoted, how effect can be minimized, that will be seen. And the third related to helicity, how to promote the normal behavior of the patient, how normal behavioral patterns and routines be promoted, what modifications can be made, how patient can be helped to reach goals, whether education is required for the patient, whether any assistance is needed for the patient, everything you will be seeing. The last one is the nursing evaluation component. In that, you need to evaluate, has the behavior changed as a result of the environmental modification, what new reactions are taking place within the patient and the environment. Is in the resonancy you will be seeing, is the patient's development normally, and in helicity you will be seeing what repatterning has taken place, or is patient moving towards achievement of goals. So this is how you need to write the nursing process according to Rogers' theory. This theory has got its own strength and weaknesses. The strength is Rogers' theory is not directly testable due to a lack of concrete hypothesis, but it is testable with its principles. If you're just seeing the principle of helicity or principle of resonance or principle of integrality, you can test the Rogers theory, and it has got a number of weaknesses, like Rogers model does not define particular hypotheses or theories. It is more abstract, unified and highly derived framework. It's a little more abstract. It's difficult for the common man, to understand this. Testing the concept's validity is questionable because its concepts are not directly measurable. We cannot measure the concepts like energy fields and its openness. We cannot measure it. We cannot see it. The concepts, everything is extremely abstract. Rogers claimed that nursing exists to serve people. However, nurse's role is not clearly defined in Rogers' theory. And last weakness is the purpose of nurse is to promote health and well-being for all persons wherever they are. However, Rogers' model has no concrete definition of a health state. So these are the strengths and weaknesses. So you need to tell about the characteristics of theory also when we are talking about a theory. The 7 characteristics, like theories can interrelate concepts, theories must be logical in nature. These two are shown by Rogers' theory. But the third one, it can be generalizable, but it is not simple in nature. The fourth characteristics is it can be basis for hypothesis that can be tested or theory that can be expanded. But here I told in the strength itself, based on the principles we can test it. Theories contribute to increasing the body of knowledge. That is another characteristics. The sixth characteristic is it can be used by the practitioners to guide and improve their practice. Roy's model and Newman's model were developed based on this Rogers theory only, and theories must be consistent with other validated theories, laws and principles. According to the open systems theory, if you see, it is something which is similar to the Rogers theory. So most of the characteristics of theory are met by Rogers theory also. But being more abstract, it is difficult for a nurse to implement this. Thus, the science of unitary human beings is highly generalizable, as the concepts and ideas are not confined to a specific nursing approach, unlike the usual way of other nurse theorists defining the major concept of the theory. It is more abstract, difficult for a novice nurse to implement this thing, but newer theories can be developed with this concept of Rogers theory keeping in mind. Hope you understood this theory. Thank you.